I am Dr. Madhu Batta, practicing obstetrician and gynecologist of East Delhi. Today I am going to talk about prematurity. Prematurity is a condition which is very common. It's a global health problem. Near about 15 million cases of prematurity occur globally in 1 year. And out of this, the 5 to 18% is the rate of prematurity. In India, out of 27 million deliveries which occur, 3.8% they are premature deliveries. Prematurity is the condition which takes place before 37 weeks of pregnancy. Normal gestation of period is 40 weeks, and if it occurs before 37 weeks, it is prematurity. And there are certain causes of this prematurity. In the structural defect or any structural defect of the uterus like septate, incompetent os, and any medical problems like diabetes, uncontrolled diabetes, hypertension, renal disease, multiple pregnancy, and any IVF pregnancies, any trauma to the uterus, and any intrauterine genital infections, they can be the cause of the prematurity. And we know that prematurity is the near about number 1 leading cause of the neonatal death, and number 5th leading cause of the death before 5 years of the age. And the patient usually present with intermittent pains of the uterus, backache, pelvic pressure, any vaginal discharge, any bleeding PV, and any leaking which occurs premature rupture of the membranes. Now we know that these complications of this prematurity usually occurs if the baby is born prematurely. There are so many problems, like the baby will be low birth weight, pale, and decreased reflexes like decreased swallowing and suckling reflex, and the baby needs ICU care at times, and baby can go in respiratory distress syndrome because of the decreased surfactant. And we have to keep the baby in NICU for some time, so that for temperature regulation and to avoid any infection. And these babies are more prone to having neonatal jaundice also, which has to be treated. Now, how we can prevent premature deliveries? We can do pre-conceptional counseling to the patient before going for conception. We can guide them. If there is any previous history of prematurity, we can do their sugar check, BP check, thyroid check, and diabetes has to be controlled, BP has to be controlled before they go for conception. And any genital infection, urinary tract infection, they have to be treated before they go for conception. And how we can prevent this premature delivery? By this preconceptional counseling to the patient, and throughout the pregnancy we can keep them, educating them, and if they are having pain, we can give them uterine muscle relaxants, and we can give them progesterones to linger on their pregnancy till term if possible. So this is the way we can decrease the rate of prematurity. We can decrease the rate of prematurity because it's a very common health problem. Babies born prematurely, they are having so many complications in life. Early complications, they don't survive, and they need special care in the NICU, and jaundice control and weight gain problem. And the later on problems, they can get intellectual problems, learning disability. So it's a very common problem. So we should take care of, as an obstetrician, we should guide them since the beginning about this condition. Thank you.